Hey, I'm Sarah Smith, family doctor, clinical day advisor, and the chatting coach. Welcome back to Sustainable Clinical Medicine podcast, where we're going to be interviewing peers or world experts who can help us think about our clinical day in a way that is more sustainable and create time for our lives outside of medicine. Hi, everybody, and welcome back to another episode. I'm excited to introduce to you Bryan Sexton, who I will let you introduce yourself in a moment, but he is in that well-being space, but we are going to see it from a new lens and we're going to love it. So, welcome.
Thank you for having me. My name is Bryan Sexton. I'm a psychologist and a psychometrician. I'm the chief wellness officer at Duke Health Integrated Practice here in the States. And I spent a lot of time creating metrics and interventions to help busy, tired, cranky, distracted healthcare workers put a little bit more gas in their tank.
Oh, I love that. See, already. Tell us a bit about your journey through your clinical days and what got you into this specific area.
Well, I spent a lot right out of my training. I went straight to Johns Hopkins, where I was a young kind of assistant professor, and I was doing a lot of work in quality improvement. And we were trying really hard back in 2002, 2003 to put bloodstream infection reduction protocols in ICUs all over the place. And so anything we could do to kind of get these infection rates down. And what happened was I was in a conversation with a brilliant, she's now a VP of safety. Her name is Lori Payne. And she was like, we keep going into these ICUs and trying to fix the quality, but it seems like maybe we should just like give people some time to recharge themselves before we give them more challenging work to do and hold them accountable for that work. And what we found was about 1 out of 3 ICUs that we went into were not ready to do the innovation. They didn't have the capacity. There was too much burnout. And that was really interesting to me because I didn't know anything about burnout at the time. So we started measuring burnout, and sure enough, if you identify which ICUs have burnout and which ICUs have less burnout, you know where to launch your intervention right away and where to delay the launch of your intervention until you do something for the staff. And fast forward, whatever, 25 years later, now we know a lot more about what you do to put the gas back in the tank of those healthcare workers before you kind of ask them to own quality in some new way.
Oh, I just love that message because I absolutely feel that to my core that I was asked to do more and asked to do more. And can you tick this box too? And you can ask them about smoking and vegetables and exercise. And I'm like, do you not understand how much I do already? And
Right.
you're asking me to do more.
One more thing, one more thing, one more thing.
One
Yes.
more thing.
Yeah.
And absolutely, we're like, yes, I am interested in infection control, but I don't have the
Right.
capacity. If I think about that, then I'm going to lose my ability to think or prioritize this.
Right.
You're
That's
asking
right.
me to take
Well,
up
and
tiny amounts of my brain space that are little.
it's you're so right. And I think a common thing back then was kind of what you and I think of as death by 1,000 paper cuts, right? A
Yes.
much more common thing now is I'm being asked to do things that kind of conflict with the way I view the world. And
Mm,
that makes me feel really bad. I don't like the way I
mm,
feel when I go home at the end of the day. And that's a difference. So that there's kind of moral injury, there's standard kind of run-of-the-mill emotional exhaustion. There's like everything
mm.
in between. And that's not even touching into things like depression and anxiety.
Yeah, okay. Now you said I didn't know much about burnout, so we started measuring it. Where were you, what were those questions you were asking them about what is that burnout? How burnt out are you? Like, how did you start to find those questions to ask to identify this thing called burnout?
Sure. So there's in the 1970s a really sage and wonderful luminary. I just adore her body of work. Her name is Christina Maslach. She's retired now, but she kind of put burnout on the map. She created what's called the Maslach Burnout Inventory, and it has three domains, of burnout. You probably heard this stuff before. There's emotional exhaustion and depersonalization and a diminished sense of personal accomplishment. And the point is, yeah, that's a good measure, but it costs money, and we needed to be able to do this stuff and not have to like, pay every time we had somebody fill
Mhm.
out a survey. So,
Mhm.
and you don't need, this is just me. You're just asking me, so I can only give you my
Yeah,
opinion.
that's right.
Um, but I'm very smitten with the emotional exhaustion domain. So I'm a psychometrician, so I create measures, and then we
Hmm.
make sure that they measure what we think they're measuring. That's kind of what a psychometrician does. And when we were using emotional exhaustion, I was just blown away by how much it predicts. So, healthcare worker emotional exhaustion predicts healthcare worker clinical outcomes, but
Hmm.
also operational outcomes, like whether or not they stay or leave their practice. But also, it predicts everything from marital satisfaction to immune system function to likelihood to get into a traffic accident. Like it's a pretty good indicator of how you're doing. The other
Mm.
domains don't have that kind of predictive power, so I'm not as kind of smitten with those other domains. They're good, but emotional exhaustion is fabulous. And so when you layer on top of that other measures like work-life integration and emotional recovery, which is kind of your ability to bounce back after an upheaval, like it really builds a multidimensional kind of well-being picture that predicts your outcomes and your patient's outcomes, but it also gives us insight into which kinds of interventions would be most appropriate for you specifically. So that's a really exciting area of research, which is kind of, like personalizing a journey in well-being. So we match this intervention to this well-being profile.
Yeah, I really like this approach because I think that we're blanketed with uh, yoga or square
Yeah,
breathing or
yeah,
like go home and get some more rest or and
right.
when this individualized approach, I'm fascinated to dive in there if you're
Sure.
to kind of understand this well-being profile. Tell us a bit more about those types of things we should be on the watch out for.
So I'll give you myself as an example. So if when I take an emotional exhaustion scale, so I got really burned out in that first job at Hopkins. That's where I learned about burnout is at that first job, and I've struggled with burnout, myself. Um, Even today, when I answer those questions, honestly, my score is pretty high for burnout for emotional exhaustion.
Mhm.
However, I'm a very avid woodworker. I like pickleball. I like to listen to books on Audible. I'm a runner. And so there's other things that I can do that can help me recharge my batteries when they get low. So the idea of a profile is kind of like this. Think of your emotional exhaustion as like the size of your well-being battery. So if you're highly exhausted, you get a tiny battery that loses charge quickly. But if you're not
Mhm.
emotionally exhausted, you get a great big battery, and it takes a while for it to lose its charge. So that's emotional exhaustion. Emotional recovery is how fast can I recharge that battery when it gets low? So I'm a very typical kind of profile for a healthcare worker. I'm high on exhaustion, but I'm also very, very good at recharging my battery when it gets low. So those are two different components of my well-being. So there are things that you can do that are particularly good at helping you recharge your battery. Spending time in nature, spending time with people who you like, not people who you don't like, but people who they kind of fill your bucket. Pickleball. I self-medicate with runs all the time. Like it's like, oh my gosh, I need like a long run for this one because this is a doozy. So there's different things that I do, but the point is it's not just are you burned out, are you not? I think of well-being as more complicated than that. It's kind of given your specific well-being profile, what are the interventions that are most likely going to help you where you are right now? So meeting healthcare workers where they are.
Mm. Yeah, I like that. I like that a lot. What else is available to us for well-being? So you've mentioned some of the nature and exercise. People are going to say, but I don't have time for that. I'm
Oh yeah.
exhausted. I need to
Yeah,
go
yeah.
home and lie horizontally.
So now you're speaking my love language, which is the bite-sized interventions. What are some small, simple things I can do that we know are effective? And we started doing this, I want to say we kind of began this work around 2009. We really started deep into the research around 2013, 2014, which is when we went live with Epic at Duke. Is when we went live with our electronic medical record. And at that time, burnout was really high because everyone's have to learn this new system and how to interact with this new system. And so using that as an opportunity to what are some things we can do for people that are simple, little micro interventions, bite-sized things that make a big difference. And by bite-sized, this is kind of a fun story, but this is I started doing this work with a colleague of mine, Jochen Profit. He's a neonatologist at Stanford. I love Jochen, and he would introduce me to people in the NICU, in the neonatal ICU, and he would say, oh, Bryan, would you explain to these guys kind of what we would be doing with the well-being? And so I was like, okay, and I'd give them the spiel about bite-sized. And this is what the neonatal nurses would say. They'd say, okay, fine. I'll do your little well-being intervention, but I'm not going to put the baby down. And if I can do it with one hand on my phone, I'll give you 1, maybe 2 minutes tops. That was the requirement to go into the NICU and use an intervention. 1 to 2 minutes on your phone that you could do pretty much just like with one hand. And all of our interventions are like that. So we have an intervention that uses humor, and that's 1 to 2 minutes a day for 8 days. We have an intervention that uses awe and wonder. That's a fun one. And that's 10 minutes for 2 days. So 2 10-minute kind of doses. We have one for gratitude, which is 7 minutes across, 2 days. So these are not like hour-long things. They really are bite-sized. You can do it in your car before you drive home, kind of a thing. Now, that changed a little bit during the pandemic, and we were asked to kind of start doing this stuff on everything went Zoom during the pandemic. So I was like, but can you do it on Zoom? And so we did something that at the time felt normal, but now in retrospect, it was kind of an innovation. We took these little interventions and we just inserted them into continuing education credits. So if you want an hour of CME or CEU credit, we're going to take 7 or 8 minutes of that hour and we're going to do the intervention. So if you get 1 hour of CME, you're going to get 1 intervention. But if you do 5 hours, you're going to get 5 interventions. And there's a dose response effect. And so that's where you can take these little things and you can bake them into things that we're doing anyway to keep it as kind of as we just want to minimize the burden on our workforce.
Got it. Love that. Tell me about going into these ICUs. That's kind of where this idea started. And you said, okay, some of our teams aren't ready for us to talk about this infection control and quality of patient care because we can see this team is not working well, they're burnt out. What did it look like to start to turn them around? Was that something you were doing, or you just kind of identified that to the hospital and said, we're out until you fix that?
Well, it's kind of a fun I don't know if this is depressing or if this is inspirational, but this is what happened. At the time, I didn't have personally a lot of interventions to offer people. I had learned a lot about sleep and the role that sleep plays, and we were introducing sleep hygiene kind of advice for people to help with the beginning stages of burnout. But really, what happened was I was being asked at that time to put bloodstream infection reduction protocols in every ICU in the universe. At the same time, I was saying to leadership, I'm not sure we should be doing this everywhere. And the response I got was, look, you're either on the train or you're off the train. We're doing this. And so at the same time, Duke was recruiting me while I was at Hopkins. And Duke was saying, like, we want to know how to do quality improvement correctly for the next 30 years. What should we be doing right now? Like, we know that we're not where we need to be. We want to do this the right way. And so it was such a different perspective that I was like, okay, I'm going to go do this at Duke. And we built a number of interventions that are all we have published. They're all evidence-based. We started with 3, and now we have 21 of them on our website.
Love that. Love that. You had written about a 5-hour intervention for healthcare workers to help really shift their well-being. Can you
Mhm.
explain what that 5 hours looks like and what you learned through that process?
Yeah, so we published that in September of 2024 in JAMA Network Open, and the intervention was essentially you sign up for 5 hours of continuing education credit, which this is maybe it's a little bit sneaky, but it was clever. What we did was we said, if you answer these 5 questions for us about kind of well-being, we'll then benchmark you and show you how you compare to 130,000 of your colleagues. So we can put you
Mm.
in a distribution. So you can get some feedback on how you're doing. Oh, and by the way, as you go through these 5 hours, it's 5 hours delivered over an 8-day period. We'll check in with you now, and we'll check in with you a week from now, and we'll show you how it changed. That promise of feedback and making the assessment part of the feedback and the feedback part of the incentive to come back and finish turned out to be like really powerful because we couldn't just give gift cards to people. If oh, if you come back and do this, we'll give you a $50 gift card. We needed something that they wanted, and it turns out busy people in healthcare, they want to know that what they did made a difference, and giving them that feedback was really a powerful way to do it.
Okay, this is interesting because as we are in training, we're often graded and evaluated and given feedback, and sometimes it's, desired, and other times it's not desired and not delivered in a way that's helpful and maybe traumatizing. But you're
Yeah.
right, we often gravitate towards something that'll give us a certificate or an idea of, how did I do? And is that the medical student in us? I don't know.
Yeah, well, and here's the beautiful thing. When you do it through this mechanism, nobody knows about that feedback but you. So it's very private, it's very individualized. And that turned out to be a really in retrospect, it was a critical way of us keeping people engaged. Because as you know, the biggest problem with well-being interventions, like, smoking cessation, weight loss, like whatever you name it, is people intend to go to the gym and they never actually do. And so well-being as a category of behaviors is, well, I'll do that when I have time, but then we don't. So this was going about it a different way. This was saying, look, if you just do this now and you'll check in with us again, like it's Tuesday, we'll do this again next Tuesday. I'll see you next Tuesday, and we'll step on the scale again, and you can look at your numbers today and next week. It's the ability to see that progress that was important. A lot of people mentioned it in their comments.
Mm. Okay, so I've got some apps that do some tracking thing, and it tells me I'm on a streak and I'm, better than 95% of users on this app. That's pretty rewarding.
Yeah, that's like the badgification of life, right? Like, oh, good for you. You get a badge. You get a badge.
That's right. So I can see as a researcher how this was super important, but also you're saying from the perspective of the user, they're calling it important too, that I could see that, hey, I'm better than my colleagues now in my well-being score.
We try not to compare. At no point do you get to see other people's progress.
No,
It's
but you're
just
on
you
that
with yourself.
distribution curve.
It's
Yes.
just,
Oh,
yeah,
okay.
you,
Yeah.
you do get to see where you fall at the beginning, but at the end, you're
Right.
just comparing yourself to yourself,
Oh,
um,
okay.
which
Okay.
is
All right.
which is pretty neat. And if I could summarize this very quickly, for what it's worth, and we've done multiple of these randomized controlled trials, but for what it's worth, the good news is, because we get this question a lot, like, isn't it the people who show up to do this stuff, aren't they just their well-being is better anyway? Actually, no. Their
Mm,
well-being is worse than average, the people who enroll. And for those who have particularly large challenges with their well-being, they're actually the ones that improve the most.
mm,
So it's not the case that you have to have the energy to create more energy. There's something really really special about doing this. And we start with something really simple. Like the first thing we do is a gratitude exercise. The great thing about gratitude as an intervention is that number one, there's good RCT data behind it. But number two, it's really safe to go to any population, even individuals who are struggling, maybe they have some severe depression or they're high in anxiety, and you can give them a gratitude intervention, and they can turn on that kind of positive emotion of gratitude, even if they're in a bad place. They can still turn
Mhm.
that on, and then if you squeeze the juice from that fruit when you're got that positive emotion working for you, it really it makes you feel better. It makes you feel better right away. And that was one of our criteria. Like if I'm going to give you as a busy, physician something to do, this is what you're going to tell me. I want it to be simple. It can't take very long. I want to feel better right away. And I want to feel better for a long time. If I'm going to do this, I don't want to feel better for 3 hours. I want to feel better for like months. And gratitude is one of those things where like a 7 to 10 minute dose of gratitude, we can detect changes in you 6 to 8 weeks later. Like not years later, but like 7 minutes in 2 months is kind of that's kind of interesting. So we start with that, and then we move into some other things that are a little bit trickier, a little bit harder to deal with, like things like work-life balance, or things like how do you cultivate hope or humor. You can probably imagine like starting an intervention with somebody who's struggling with anxiety and saying, "What are you looking forward to?" It might not work for them. So we've learned which kinds of positive emotions and which kinds of interventions you should start off with in a sequence, and then how to build on that and how to dose it the right way.
Yeah. Can you give us an example of a question around gratitude so we can have some idea of what would we be asking ourselves
Mhm.
for a gratitude exercise? Because I'm not sure. Can I do that on the spot for you?
Sure, sure. I mean, if you've ever done this while you're sitting waiting for like a presentation to start, and you just take out your phone and you send a warm fuzzy to a loved one, like it's amazing how that makes you kind of feel like better, like even if it's just for a minute. The way and I can give you the story like where it came from if you're interested in
Mm.
like the history of the intervention, but I can tell you the intervention itself is very straightforward. It's just okay, I'd like you to think of someone who's done something amazing for you. They can be alive or no longer with us, but they did something amazing for you. And they didn't have to, but they did. And you really benefited from that. And what I want you to do is spend the next 7 minutes writing a note of appreciation to this person. Tell them this is what you did. This is why it meant so much to me. And this is how I feel. Um, just that you're writing a letter to that other person. The act of doing that is like bathing your prefrontal cortex in the positive emotion of gratitude, which has some interesting side effects. Like you'll sleep longer, you'll sleep better, you're much more likely to engage in exercise. And what's really cool about gratitude, if you spend a little time in gratitude now, you grease the skids to make it easier to feel hopeful for the next 2 weeks. So it's the precondition for being able to look forward to things and be optimistic. So there's some really interesting things that happen when you dose it correctly. But it's just you spend 7 minutes writing that note. Now, if you give it to someone, you actually spread the intervention in a very direct way to the person that you write it to. But if that person you wrote the letter to is no longer with us or you don't know where they are, you can share your letter with someone who knows you or knew them,
Hmm.
and to kind of close the loop. Um, just though writing the letter, even if you never send it or never kind of talk to that person, just writing the letter itself is such a simple act of, I don't know, well-being defiance. It's really interesting.
I love that. Okay, where did that come from? So tell us the background of that ability to do that exercise and why that was the place we start if we really want to grease our wheels for well-being.
Okay, okay. This is kind of fun. So Bob Emmons is a psychologist he's like the world's leading expert on gratitude research and in spirituality research. He's those are two cool things to kind of like be a guru on. And he had people. This is like the year 2000. He had people write in it was a diary study where you'd kind of write in a journal every day for 30 to 45 minutes about all the things that you're grateful for that day.
Mm.
And what happened is the people who wrote about things they were grateful for relative to the control group was people who wrote about there's two controls, people who wrote about how they spent their time, or people who wrote about things that they were struggling with. So there are three
Hmm.
conditions.
Hmm.
And he showed us that after 21 days of doing this, the people who were in the gratitude condition, they actually significantly reduced their depression, significantly increased their subjective well-being, so their happiness, and there's all those other effects with like exercise and what have you. Now, fast forward, what we now know, and this is kind of the role of Marty Seligman, who's a positive psychologist. He's like, well, I'm a clinical psychologist, and I see severely depressed patients. These guys have a hard time getting out of bed. They have a hard time driving a car or holding down a job. Giving them the task of writing in a journal every day for 30 to 45 minutes for 3 weeks is overwhelming for them.
Hmm.
So how do we focus it? How do we concentrate the dose so that it's not so onerous? And so it was designed. So originally, this intervention that works so well for healthcare workers was an attempt to concentrate another intervention for people who had a hard time just following through with stuff. And so the way that they did it was, instead of making a list of, oh, I love chicken and I had a nice talk with my manager and I got to walk the dog, and instead of making all those lists, they would say, just make it about one person. Can you focus that emotion on one person and just write nonstop for 7 to 10 minutes about what that person did? That turned out to be a sufficient dose to kind of get the benefits. And it's easier to get somebody to do something one time for 7 to 10 minutes than it is to get them to do it, multiple times over
Hmm.
time.
I love that. I also think that the self-reflection, like what am I grateful for? What about my day was good? Feels a little bit strained when you're feeling emotional burnout. Whereas when you're thinking about what someone else did for me, it increases the I'm lovable, I'm
Yeah.
worthwhile,
Yeah.
I'm seen by others, I'm connected. Like it actually
Yes.
has, when you were describing that, I'm like, oh, that's so much easier than
Yeah.
writing, I'm grateful for my lunch today. Or
Right.
I'm grateful
Right.
that I got 5 minutes to eat my lunch. Whoopie-doo, me. Right?
It's fascinating. So I don't know if you're familiar with self-determination theory, but it's basically this idea that these fundamental human needs are to feel autonomous, like I'm in charge of my future, feel connected to others, so relationships and what you get out of relationships, and to feel a sense of, what was the other one? Purpose, I think purpose and meaning. So what's interesting is that those core human needs, feeling connected, feeling like you are competent at something, and feeling purpose, kind of all three of those are either directly or indirectly hit with this one little intervention. So it's we find that people are they're pretty surprised at how much better they feel after a short time. And they're also like, well, if I could feel that good in 7 minutes, what else? What else you got? You got anything else like that? And so that's what we did, was we built out a kind of a buffet of
Hmm.
different things. So we have an awe and wonder intervention where you're going to cultivate kind of like in New Zealand. I'm sure you've got lots to gawk at. We have a self-compassion intervention where you kind of take the time to, and it's interesting that you're talking about how it's easier to do it for someone else. That's actually how the self-compassion intervention
Hmm.
is designed. So we want you to write a letter to yourself as if you were writing it to another person, because you would never talk to another person the way you talk to yourself. You would
Hmm.
never do that. So I want you to write this letter as if you're writing it to another person, but it's actually for yourself. And it's really interesting to get people out of their typical frameworks and mindsets. And these are all just brief reflective activities, right? That you do kind of with your mobile phone, like while you're, uh, while you're waiting for your kid to come out of soccer, or you say football, probably.
Yeah, no, absolutely love this. Okay, so take us back. If you were going now into your original project where you had to increase the quality of patient outcomes in those ICUs and hitting high burnout, what do you think it would look like now to do that if you were walking into a group of people that look terribly burnt out?
Oh, I don't think in 2025, 2026 we could do the kind of stuff that we were doing 25 years ago. I think if you say, okay, I've got these great ideas for new protocols and new ways of tracking the quality of the work that you're doing, you're going to get something heavy thrown at your head if you were
Yeah.
to try to do that like right
Yeah.
now.
Yeah.
Um, and I think part of what we have also learned is just like there are we were talking about gratitude and hope, and there's other positive emotions like awe and wonder and interest and love and joy, pride. There's 10 of these positive emotions, but we can also take the same concept that we've put into these individual interventions, and we can put them into leadership strategies and into when you're rounding with your teams, what are instead of asking, how are we going to harm the next patient around here, and what can we do to prevent that? Which is a very standard kind of old school way of initiating a risk-related conversation.
Mhm.
Now you can say, well, tell me three things that are going well around here, despite the fact that we've got all these problems. What are three things that we're still doing well, and then one thing that could be better? And so now you're bringing the kind of positive emotion, like here's what I'm looking forward to. Here's what I want to give a shout out to. Here's something that really gives me meaning at work. Oh, and by the way, if we could just get rid of this pebble in my shoe, oh, it makes such a difference. So you can take the same concepts that work in the individual interventions and bake it into what we're calling well-being informed leadership strategies. How do you kind of meet people where they are?
Okay, love it. So if you were going to walk back into those ICUs, you might say, "Oh, our evaluation shows high burnout." I might grab the leaders and take them out of the ICU for a few hours, and I'll bring them back to you, and then they can see, and then we'll come back and do our intervention in a few weeks.
It's funny. Like, how would we do that now? I would actually do a well-being screen on all healthcare workers before asking them to take on a new task, and
Yeah, that's what I'm
and
kind of thinking you
yeah,
would do. Yeah.
and framing it very specifically as um, and this is I don't know what y'all do there, but here we do routine safety culture surveys and employee engagement surveys, and one of the things that uh, we started doing is instead of saying the standard spiel, which is, oh, we're going to give you the survey. We want to hear your voice. We want to make sure that your voice gets kind of responded to. Instead, we flipped it and we said, look, we're going to give you the survey, but the point is we're going to measure your well-being. At the end of the survey, you're going to hit submit. And it's not going to say, thank you for completing the survey. It's actually going to say, based on your responses, here are our top three recommendations for specific well-being strategies that are most suited for your level of well-being right now, if you're interested. And if you engage in one of these well-being strategies, you can also get some CME or some CEU credit if that's helpful to you. So it flips it, it makes it for them. You also then look at the readiness, the kind of the well-being readiness being kind of quality improvement readiness in the same sphere. So you get a real sense of what's the pace and intensity that this group of people are ready to tackle right now, given where they are.
Mm. Oh, wouldn't this be wonderful to have before we got given the next, you know, I want you to add this to your plate, or I want to do a overhaul or revamp of our electronic medical record, or here comes a new billing protocol.
New dashboard where you're going to be held accountable in new ways. Yes. Yes.
Oh, this would make life so much kinder.
Yeah, unfortunately, I will say this. There's, COVID, the pandemic really did a number on well-being, and well-being was not in a great place for healthcare workers before the pandemic. So it
No.
really did a number. What's happening now is a sharp increase in acknowledgement that well-being is critical, but that sharp increase is not also associated with a comfort level in doing something about it. There's not a lot of money in this space. There's not like 50 things to choose from to solve this problem. And everyone's shaking their fist at the sky and saying, if you just fix the system, it wouldn't keep breaking us. And I so resonate with that. Yes, the system is broken. So guess what? We're going to have to do two things. we're going to have to work on the system and help the people that system harmed. We have to do
Mm,
both of those things. It's not an either or.
mm.
It never was an either or. And I think what's happening now, the good news, if I can put the half full glasses, half full spin on it, is that there's a recognition that this is a profound problem. Um, 5 years ago, I would talk to senior leaders and I'd hear the phrase, I didn't become a president of this institution to worry about the work-life balance of the damn nurses. But you would never hear that sentiment today. They might not know what to do about it, but there's a deep recognition that the well-being is core. And if we're not paying attention to it, if we're not measuring it, if we're not making it better, we're going to lose the people that we don't want to lose, the
Mm.
people the people who should be staying. And that's, you know, so we're working on it. Science is racing to keep up with the needs of the moment, and we'll get there. We'll get there.
I like that there is science in here measuring and helping because it's not just measuring and showing us how bad our burnout scores are. It's measuring and creating the tools to help us kind of start to address that within the systems that we're working currently. And that's really important.
That's right.
Yeah. Thank you for your work.
No,
Is there
thank you.
anything we haven't spoken about that we should be talking about before we round out today?
Anything we haven't talked about? Um, I would say this. So, number one, anybody who's interested can use any of the tools on our website. I don't know if it's helpful to say it, but
Yeah, please do. Absolutely. Add
it's
that in.
it's cause.dukehealth.org. It's caws.dukehealth.org. And there's a tools page. All those tools are free. So what I would suggest to anyone listening is try a tool. Just try one. And if you like it, share it with other people. And if you don't like it, do something else and share that with other people. But what we need right now are people to be a light in the darkness. So kind of everybody grab a candle.
I love that. Thank you so much for those tools too. I think that we should all go and have a check out of those. I think you've explained some of those to us. It's made it very practical and shows us that you've really thought about us, making it tiny and bite-sized and not just pizza.
Yeah, that's right. That's right. Yeah.
And
No,
not just sleep and not just yoga. Like there's actually tools that then have measured outcomes 7, 8 weeks later. I loved that.
yeah.
Mm.
Yeah. Well, our longest outcome is 12 months later. So we in two of our randomized controlled trials, we did 12-month follow-ups. And fun fact, and this really blows away leaders when I show it to them. Um, Between month 6 and month 12, well-being continued to improve. So let me just say, what pharmacological agents are you aware of that if you take it for, a week or a month and then you stop and you never take it again, look like you're on a higher dose a half a year later?
Yeah,
I
that's
mean, it's
incredible.
it's skills, not pills. It's we're
Mhm.
teaching people how to kind of view the world in ways that fill their bucket, and that's really, I think that's because if you go off of if you're taking SSRIs and you stop within a few weeks, the effect totally melts, and it's as if you were never on them to begin with. But that's not what happens after you do some of these bite-sized interventions. And that's what's kind of cool. The fact that we can measure 6 and 12 months later and see that not only are you still doing okay, but you're even better than the last time we measured. That's really cool.
Mm. I also liked how you said that when we did this 7 minute gratitude exercise, you were more likely to start exercising. You were more likely to start looking after
Yes.
yourself. And I'm like, when we say to people, get your exercise in, and they just sit there with glumly and with zero, with apathy and with
Yep.
zero desire to exercise,
Yep.
the answer is not you just get up and you go for a walk. That's not the answer. The answer is, well, how about we do this 7, 8 minute exercise, gratitude exercise on paper. It doesn't require any steps. And we'll just see what happens. Like, isn't that fascinating? Our brain is so
Super cool.
fascinating.
It's super cool. And the person who does this research is Barbara Fredrickson at the University of North Carolina, Chapel Hill. For 40 years, she's been doing research on this. And one of the things that she's shown is that when you focus your kind of positive kind of thoughts and energy on another person, it something clicks inside where it's like if I can be kind to that other person, I can probably also be kinder to myself. So that's part of what happens. But when you're writing that letter of gratitude to that other person, you're saying, yeah, I probably should, have a salad with lunch. I probably should go on a walk after work. I probably should. And it's not that you're even conscious of that, but it's kind of what's happening in the background is you're giving yourself permission just for self-care.
Mm, yeah.
It's not even in your awareness. If we were to
Yeah.
ask people, I don't think they would report that, but that's what's happening in their behavior.
Yeah. It's kind of like you do it in a sneaky way. You're like, are you exercising? No. Well, how about we do this exercise for a minute?
Yeah, yeah, yeah. A little spoonful of sugar, a little gratitude to get you to put your shoes on. Yeah, yeah.
Go do this exercise, come back in a week and show me what's going on. It's fascinating. It's fascinating. I geek out on brain interventions. Like we were talking about before, you have this 5 hours of CME accredited interventions for
Yep.
healthcare workers and their burnout scores, well-being scores, so much better. We see this similar if they come in and start to do that strategy and understanding that I can have different without changing my environment. I want different, and I'm going to go get it, and I can get some tools and help with that. It doesn't take very long, and they get massive change. And we're like, how is this possible? They've been
Right.
doing it this way for decades, and suddenly this little teeny tiny amount of time, and the world is a different place. And
Right.
brain hack, so good.
So I'll layer one more thing on top of that. If you're in clinic and you have not yet done one of these interventions, but 60%, let's say there's 10 people in your clinic and six or seven of them have already done it, but you have not. When we measure you again, you show improvement too. So there's a contagion effect. So that rising tide lifts all the boats. It's really interesting. So it's a double-edged sword to be clear, because if you're working with a bunch of colleagues that are just like, oh my gosh, everything is so doom and gloom and they're so nihilistic and I don't know if I can deal with that today. Like that, it's contagious in the negative direction and it's
Hmm.
contagious in the positive direction. So
Mm,
when you're doing these interventions, another thing to be recognized is you're not going to hit everyone. Not
mm.
everyone's going to be willing to do it, but you don't have to get everyone. You just have to get enough.
Well, I love this. I remember when the new Epic was rolled out in Alberta. And we basically got together as a team and we said, everyone's going to have cranky faces for 3 months. It's going to be terrible, but we'll get through it. Like it was it was not delivered in a way that had us prepared with a good well-being exercise ahead of time. And so if I went back now,
Yeah, yeah.
this might look a lot different.
That's right. I wish if we had known then what we know now, my goodness, the people who might have practiced medicine for another 5 or 10 years would be much
Oh,
higher.
100%. We
Yeah.
lost nurses
Hmm.
because they were like, there's no way with where we're already at, and now you're going to add that to
Yeah.
my day. I can't survive that. This is not good for my emotional health. I got to leave. And we
Right.
lost really good, competent, many years of nursing. And they're like, well, I'm out, tapping out. No, thank you to
Wow.
that.
Yeah. Too much change. Yeah. Never mind. I'm gone.
Yeah, that's right. When you already don't have capacity for what you're doing because you're already feeling like you're doing too much, and we add something big like that, yeah, it's like I don't even want to sign up for that. I don't even want to start. When they told us it was going to be 18 hours of online training, I'm like, that's more than I spent learning kidney in medical school, like honestly. And this is for an electronic medical record. This is for a computer system. It's going to take me 18 hours in my own time. And I'm like, oh, wow.
Yeah. For a wonderful glorified cash register that you now get to participate in. Yeah. Congratulations. Yeah. It's such an interesting. We live in interesting times. We certainly do.
Yes.
I will say that this is a fun kind of parting comment. My wife's a therapist, and she says this sometimes. Um, at times like these, you need to eat delicious food, with people you love and laugh at the calamities of the world.
That is so wise. That's bite-sized. I could do that.
Right, there you go. There you go. So who you can call, have that good meal, and make sure you laugh.
Thank you so much for this practical conversation and bringing us some really great questions we can start asking ourselves now to help our well-being, and showing us that there are available tools online that we can go and do right now. I really appreciate your time today, Bryan.
It's been my great pleasure.
Thank you. And everyone have a great rest of your day. Bye. Hey, if you found this podcast episode helpful, I would encourage you to like and subscribe. Every time you do, you help a colleague or friend find our podcast, and it can help them too. Don't forget to share it along with your friends. If you're looking for extra help, don't forget we have Charting Champions for physicians and Smarter Charting for nurse practitioners and other clinicians to help you get home with your work done. We are helping you create sustainable clinical medicine. Thanks for listening.